Welcome to my YouTube channel. Today I'm going to talk about low back pain, which is one of the most common conditions affecting people in the world. In this short video, I hope to cover the high points of low back pain and describe how it's diagnosed and evaluated through the eyes of a pain medicine physician. Now, the most common types of low back pain may be familiar to most healthcare providers, but is not necessarily familiar to most patients. And so that's my goal, to describe the most common causes of low back pain, but also the rarer causes that are more concerning that patients should be aware of and should be evaluated by healthcare providers. Now, there are many causes for low back pain. The most common causes I think of include muscle type pain, such as muscle sprains or strains. I also think of arthritis. This typically afflicts patients who are older. As they age, their joints in their bones and their spine tends to wear and tear, and that arthritis can be associated with inflammation, and that too can cause pain. In addition, the spinal cord in the middle of the spine there's a tight diameter around the spinal cord. As one ages again, that space surrounding that spinal cord tends to degenerate and could narrow, and that could lead to a condition called spinal stenosis. And spinal stenosis can also lead to pain, not only in the low back, but also radiating symptoms and referred symptoms into the legs as well. And then finally, I also think of something called degenerative disc disease. In our spinal column, in addition to the bones that hold our spine upright, there are also discs that cushion our spinal column. There are pain receptors within that spinal column, as well as the discs within that spinal column. And so sometimes that could be a generator of pain. Discogenic pain is what we call that type of pain, and it typically afflicts middle-aged or younger patients most of the time. Now, before I even talk about how a pain provider thinks of low back pain, I want to first mention something very important. This is something called red flag symptoms. Now, red flag symptoms are typically warning signs that might point to an underlying disease process that should be treated immediately and evaluated immediately. So, for example, if a patient has unanticipated weight loss, they're not trying to lose weight, but they're losing weight regardless. That could be a red flag symptom and should be evaluated. It might potentially point to cancer or a nutritional deficiency, for example. If a patient has new nerve findings, so for example, if they're having weakness, new onset weakness, their legs are weaker or heavier, or they're having new sensory abnormalities, they're not able to feel certain sensations, they're having numbness in certain regions of their legs, those could be also concerning findings and might point towards underlying nerve damage that needs to be evaluated emergently. In addition, if patients are having incontinence, if they're not able to pee or if they're peeing too much, or if they're not able to poop, for example. So urinary or fecal incontinence are also red flag symptoms and need to be evaluated emergently. And then finally, if you're feeling numbness around the genital area or the anal area, those are also red flag symptoms that warrant immediate intervention and investigation. Now, going on to the interesting part of this talk, I want to show every single patient how a pain provider might think of and evaluate low back pain. So I typically break down low back pain into three separate potential causes. And so if you look at the spinal column, there are three different segments of the spinal column. There are your anterior elements, your middle elements, and there are your posterior elements. In your anterior elements, this includes the vertebral bodies itself. These are the bony structures that hold your spine upright. In between these vertebral bodies, there are disc material. Disc material is slightly hardened gelatinous material that cushion your spinal column and helps take up and absorb some of the stress throughout your spinal column. Now, when I look at the anterior elements, either of these structures can lead to pain. So as I mentioned earlier, the disc in the middle that cushions these vertebral bodies, these discs have pain receptors, and sometimes these pain receptors can get inflamed and can lead to pain. This type of pain typically gets worse with activities like bending, for example, or sitting down typically. Now, vertebral bodies itself can also be a source of pain. I think of vertebral body fractures in patients that are older or who have osteoporosis. They may be prone to vertebral fractures. In addition, patients who have had recent trauma, for example, they could also experience vertebral body fractures. And then finally, patients who have had cancer that has spread to their vertebral bodies. Sometimes those patients can have spontaneous vertebral fractures despite lack of history of having a trauma. Next, I look at the middle elements of the spinal column. So when I look at the middle elements, you look at the spinal cord itself. These contain the nerves that transmit signals from your brain and into the rest of your body, and also receives signals from the rest of your body and transmits it into your brain. So when I look at the spinal cord, I look for causes like spinal stenosis. As I described spinal stenosis earlier, this typically involves a tight space that's surrounding your spinal cord. As you can imagine, as that space tightens, it restricts the signals that are traveling to and from your spinal cord. And that could lead to not only pain, but nerve deficits. In addition, when the nerves exit the spinal column, they also go into the rest of your body. Sometimes the holes where these nerve roots exit from can also get compressed and can also be a source of your pain. And then finally, I look at the posterior elements. Now, your posterior elements contain your joints, like your facet joints. These joints help hold your posterior part of your spine together and help assist with certain movements like bending or extending your back or moving your back from side to side. As one ages over time, there's a lot of wear and tear along the facet joints. That wear and tear can lead to inflammation around the facet joints, and that could also be a source of pain. Now, in between your facet joints and between your spinous processes, there are also a lot of ligaments surrounding that region. That too can be a source of pain. In addition to facet type pain in your low back region, there's also something called sacroiliac joint pain. Similar to facet pain, sacroiliac joint pain involves wear and tear and typically arthritis leading to inflammation, and that too can lead to low back pain and buttock pain. In reference to abnormalities with these middle structures, including the spinal cord or the exiting nerve roots, this can sometimes lead to referred pain symptoms that travel down your legs. We typically call this radicular pain symptoms in our field. Now, there are numerous options to treat low back pain, but each type of low back pain or each cause of low back pain should be individualized because not all treatments fit and treat all types of low back pain. And so it's very important to visit with a specialized pain medicine provider or anyone else that's experienced in treating low back pain to determine what treatment option is best for you. Typically, most patients with low back pain will start off with conservative therapy that involves very low risk. This typically involves starting with physical therapy and exercising and conditioning those low back muscles. As you can imagine, your low back muscles are absorbing a lot of the stress that's involved with activities utilizing your low back, such as bending or lifting or walking. If these back muscles are not conditioned very well, a lot of that stress can go on the joints, the facet joints, the spinal cord, the spinal column, and that could lead to hypertrophy and changes in the bone structure, and that could also lead to inflammation along those joints. In addition to physical therapy, we also look at medication options. Initially, patients trial options like over-the-counter medications, including Tylenol, or various non-steroidal anti-inflammatory agents like ibuprofen or naproxen, for example. Sometimes topical lotions like lidocaine patches may help. Sometimes these treatment options might not help, and stronger medications like opioid medications may be used to treat acute exacerbations. I typically advise against using opioid medications as they only provide short-term relief and they have a lot of side effects. Patients also develop a tolerance to opioid effects, and over time, these medication doses tend to increase and stop giving much therapeutic relief to patients. After exhausting conservative options as well as medication options, we offer injection treatment. This typically involves either steroid injections at various locations or other more specialized treatments like radiofrequency ablations, which end up burning certain nerves that are causing pain. Finally, there are more interventional options that are more invasive than injection therapy. This may involve things like spinal cord stimulator therapy. I provide more details about spinal cord stimulator therapy in another video, and I provide the link details below. Also, spine surgery is another potential option, and each patient should be evaluated on a case-by-case basis by a spine surgeon to determine if they are an adequate candidate to benefit from spine surgery. So I hope this was helpful to describe the high points of low back pain, how a pain medicine physician thinks about low back pain, particularly looking at the anterior column, the middle elements, and the posterior elements, and then also describe some of the most common treatment options. Again, this is not an exhaustive list. There are definitely other conditions that have not been discussed here in this video. In other videos, I do hope to discuss things like spinal cord stimulator therapy, opioid therapy, and my views on that, and other more novel therapies like stem cells and regenerative medicine. So please stay tuned for future videos. Don't forget to hit that like and subscribe button.